Hey, good morning, everyone. Thank you so much for being here on such a beautiful, sunshiny day. I'm Kent Shortridge, Vice Chair of Community Initiatives for the Greater Oklahoma City Chamber and Managing Vice President of Operations for One Gas. Today's Chamber Forum will allow us to have an important discussion on the issue of homelessness in our community and what we collectively do to make sure every Oklahoma City resident has a safe place to call home. We have a dynamic panel of community leaders who are engaged in this issue, but before we hear from them, I would like to recognize our signature sponsor, Cox Business. Please help welcome Sean Davis, Sales Manager at Cox Business, to the stage. Sean?
Kent. Good morning, everyone. As Kent said, my name is Sean Davis. Welcome to the Oklahoma City Chamber Forum Luncheon. I've worked for Cox Business for several years in several capacities, but my most recent role is now as a sales manager on the small to medium market business side. And I love working for a company that emphasizes the importance of being an active part of the community and values giving back to the city that has helped us thrive as a company. Given the importance of today's topic that the panel will be discussing, the challengedness of homelessness here in Oklahoma City, I felt compelled to mention a few of the programs that Cox has invested in through the years. Through the Cox Charities Community Investment Grants, we have given to the Homeless Alliance, as well as to the Sunbeam Family Services Program that benefits homeless seniors. In addition, through several of the community partnerships we have developed at Cox, we continue to give to many local nonprofits for the overall benefit of Oklahoma City. Also, Cox has made it a priority for all of their employees to give back and volunteer to the communities in which they live. Each Cox employee is given dedicated time off to utilize for volunteer activities in the local community, and we are always looking for additional opportunities to explore for giving back. So please feel free to reach out to myself or any one of us from Cox Business if there are any opportunities we can explore. Again, thank you for coming, and enjoy.
Thank you, Sean. I'm also pleased to recognize our corporate sponsor, ADG. So thank you to all of our sponsors today. The purpose behind Chamber Forum events is to give our business community the chance to engage in discussions around the topics that matter to the future of Oklahoma City. And I can't think of a better example of an issue around which we should rally than ending long-term homelessness in our community. Consider the following statistics from the most recent point-in-time count released by the Homeless Alliance. In 2019, there were a total of 1,273 countable people who are experiencing homelessness in Oklahoma City, which is a slight increase from the previous year. 10% of that population are veterans, 16% are members of families with children, 15% are younger than the age of 24, 31% of the population reports mental illness. This also impacts our community's children. At the end of the 2018 school year, Oklahoma City Public Schools estimated that 3,445 children in their district were experiencing homelessness. These are sobering realities for many of our neighbors, but fortunately we have a growing ecosystem of services designed to transition people out of homelessness and into a more stable life, some of which we will highlight today. We're going to dive into the factors that are contributing to homelessness in our community, what's available to meet those needs, and perhaps most importantly, what more we can do as a community to impact the issue in today's panel discussion. But before we begin, please enjoy your lunch. I'll be back shortly to introduce our panelists. Well, please continue to enjoy your lunch as we bring on our panelists to the stage. Their complete biographies are in your program, but please help me welcome Ranya Forgotson, Director of the Curbside Chronicle. Rachel Freeman, Chief Operations Officer of City Care. Cathy O'Connor, President and CEO of the Alliance for Economic Development of Oklahoma City. Exactly. And Dan Straughan, Executive Director of the Homeless Alliance. Thank you all. Wow.
Oh.
Thank you all for being here today. If you would, take a couple of minutes to introduce yourself and give us a brief summary of what your organization does as it relates to providing resources to people experiencing homelessness in Oklahoma City. Dan, start with you, please.
So my name's Dan. I'm the exec and the founder of the Homeless Alliance. Our mission is rallying our community to end homelessness. As a function of that, we facilitate broad-based community collaborations to address homelessness. We have a campus for homeless services that's a little west of downtown at 3rd and Virginia, and we have professional staff there from about 30 different government, faith-based, and nonprofit agencies providing services to the homeless. The campus also has Oklahoma City's only general use day shelter. Then we have offices for other case managers serving the HIV positive population in Oklahoma City up on 39th and Penn. And of course, you probably know us because we have one of our programs is Curbside Chronicle.
Cathy?
Yeah, I'm Cathy O'Connor. I'm the president of the Alliance for Economic Development, and we help the city manage all of its economic development and redevelopment programs, mostly focused on projects that need help from the public sector. So we've been working to develop some new local incentive programs to help support the development of affordable housing in Oklahoma City, because we think that's the kind of the first effort to try to end homelessness is by having more affordable units.
Hi everyone, I'm Rachel Freeman with City Care. City Care was founded in 1996, and how they started, it was a meal for those experiencing homelessness. And after the Murrah bombing happened, there was some transitional housing that was destroyed, and City Care took it on to rebuild it. So the group that had the transitional housing was not able to rebuild it at the time, and so City Care took that on. Over the last 25 years, we have built 114 affordable housing units. So we build those without debt services, and then we case manage the individuals for the duration, for the time that they live with us. Also, the last 8 years, we had the distinct honor of being the contractor for Homeless Alliance to manage their day shelter. And with that knowledge that we gained through that contract, we have purchased a building at the end of 2018, and we'll be opening the city's only low barrier night shelter at the end of this year.
Ranya?
Yeah, I'm Ranya Forgotson, and I'm the director and the co-founder of the Curbside Chronicle at the Homeless Alliance. The Curbside Chronicle, I believe that everyone actually got a copy of our magazine today. It was last month's issue, which talks entirely about the issue of homelessness here in our community. And what the Curbside Chronicle is, we're a street paper. I didn't create the idea, I just helped bring the concept to Oklahoma City. So around the world, there are about 115 publications like ours, known as street papers, and we all have different names and are printed in different languages and styles. Some are newspapers, some are magazines, but our purpose is the same. And so street papers exist to provide a dignified way for people experiencing homelessness to earn an income, regardless if they're sleeping outside right now are staying in a shelter or struggling with a mental health issue, they have the opportunity to sell a product and get some money in their pocket through that sale. Also, our magazine, within our 32 pages, we try to help amplify the voices and the stories of people experiencing homelessness. That's something that I hope no one in this room ever has to experience, but there's a lot that we can learn from people and what they've gone through and how just resilient what it is they face is. And so we're really grateful that our vendors share that aspect of their lives within our magazine so that our readers and our customers can hopefully learn from those situations. And then lastly, our mission as a street paper is to foster community engagement between people who might not normally have an opportunity to engage, right? Homelessness can be a very isolating thing to experience, and it's not normal per se in our society for folks to get the chance to speak with someone in that situation, or for folks who are in that situation to feel like they should and can be seen and represented and heard in our community. But what Curbside does by giving people employment and a uniform and a product to sell, and by giving customers and a chance to engage with folks, we help break down some of those socially isolating walls and take away some of that just uncomfort, where you can just say, hey, what's in this current issue of Curbside, and have a conversation with someone and get to know them as another human being.
Very good, thank you. Okay, Dan, get us started.
Okay.
With a basic overview of the state of homelessness in Oklahoma City, talk to us about the statistics of who is experiencing long-term homelessness, the most common factors that lead to homelessness, and any other trends you are noticing on a local level.
Okay, sure. Well, and I guess I would really want to start with the long-term trends. So we're very fortunate as a community that we are on a 10-year trend of slowly declining homelessness in our community. When the Homeless Alliance started in 2004, our point-in-time count was about 2,500, and now it's about 1,250. So we're on the right track. During that period, though, each year more people have become homeless. We've just gotten, as a community, much better at getting people back into housing. And that's why our single night count is going down, but our annualized count is going up. The population very consistently has had about 35% self-report serious mental illness, and about 30% or so self-report substance use issues. That doesn't mean that 65% of the homeless have one or the other, because there's a lot of overlap between those two. The contributing factor is really easy, and so easy, in fact, that if you ask a 5-year-old, what's the matter with people who are homeless, they're gonna look at you like you're maybe trying to trick them. They might roll their eyes if they were one of my kids, and they'll say, well, it's homes, isn't it? And that's it. That's the root cause of homelessness, is availability, accessibility, affordability of housing for people in poverty. Oklahoma County has 135,000 people that live in poverty. That's $12,000 a year. If we have one of the most affordable housing markets in the country if you're at 80 to 120% of AMI. AMI in Oklahoma City is 50,000. So if you're making 40 to 60,000, we have a fantastic market for you. If you're making 12, we just don't have enough of that kind of housing. That is the root cause of Oklahoma City's homelessness. It's the root cause of any big city's homelessness.
The next question is for Rachel. In 2018, we saw an increase in people living without shelter, even though overall rates of homelessness had declined. What barriers are there that prevent people from seeking shelter, and how has City Care adapted its model to help eliminate those barriers?
Yeah, I just want to add to what Dan said. the understanding that the large-scale homelessness that we see in the nation today, it's a relatively new problem at the scale that we see it today. So when you look at the 1980s, you will see that the federal government cut funding to cities to provide affordable housing. And at that time, the level of homelessness that we see today that we take for granted was really, it was seen as, it was a crisis level. And we've just sort of become attuned to that and accustomed to that. What barriers keep people from housing? Not to oversimplify the issue, but to echo what Dan said, it's there aren't enough houses. We have a critical lack of affordable housing in Oklahoma City. What keeps them from shelter? I hate to guess what keeps them from shelter, and so I can only tell you what they tell me. When I had the opportunity to go out on this year's point in time count, it was so awesome, and if you ever get the opportunity to volunteer for that, it's such a great thing that the Homeless Alliance does and that they invite the community into. And it was January 24th, it was 34 degrees, and we met people in encampment after encampment, and when we talked with them, the things that they tell us is that they don't want to go to shelters because they don't want to be split up from their person. So oftentimes shelters split up people by gender, and they don't want to be split up from their partner. It could be that they have a pet, and some of the shelters don't, they have a no pets policy. It could be requirements for sobriety. It could be transportation issues. There's lots of things that keep people from shelters. But when you're talking about Oklahoma City, you're talking about life or death. So we have to become flexible and overcome as many of those obstacles as we can. So what City Care did is, and this isn't, it's not rocket science, and it's not, we just did the next right thing, and the next right thing is to fill a gap and to create beds for people that don't currently have beds. There are other shelter programs in Oklahoma City that do awesome work, and they have program requirements that work for them. And those program requirements don't work for every person that's out on the street. So we said, let's take a stab at this, at having a low barrier night shelter, and we'll, those barriers that people are telling us on the point in time count, let's have a pet hotel. Let's try it. Let's have family units in our shelters so that families can stay together. So that's what we're going to try. And we're comfortable not knowing how it's going to go. We're just going to keep trying until we eliminate the number of people on the streets.
Very good, thank you. Cathy, another key part of this conversation centers on affordability. Can you give us the landscape of affordability in Oklahoma City, especially for people in the lower income brackets, and how that impacts this conversation overall?
Yeah, I think, one of the things is to try to understand some of the statistics and the numbers about the numbers of households we're trying to deal with and how that matches up with the number of units that are available to them. So some of you may not be familiar with all the jargon that we like to throw around in this industry. So one of them is AMI, Area Median Income. Dan said it's $50,000 in Oklahoma City. But for most of the people that we're talking about, they are at 60% of AMI or 30% of AMI. And so at 30% of AMI, you're considered an extremely low income household. So, and in that bracket, we have about 59, almost 60,000 households that are in that bracket. And for every one of them looking for a house, we only have 34 out of 100 household units available. So we have a pretty big gap in the number of units that are available for people. A lot of those people are very cost burdened. So the other thing that we talk about a lot in the affordability sector is if you're paying more than 50% of your gross income for housing, you are considered cost burdened. And for most of us, we can't even imagine spending that much on a house. But so for those people, I'm going to look at my paper so I get some of these numbers right. There are about 53,000 ELI households in Oklahoma City, And the report estimates, this is a report by the National Low Income Housing Coalition, estimates that about 69% of those ELI households are extremely cost burdened. So that means they're paying more than 50% of their income for housing. And so the real challenge for us is to create more units, and you've heard that over and over again. And I think part of the conversation is we need to create lots of different kinds of units. We need to create units that are available for people at every level of that income spectrum, so the very low income. We need units that are affordable for people that make 60% of AMI. Some of the programs that Oklahoma City has recently implemented are really targeted at that 60 to 80% of AMI. So those are people who have jobs, they have good jobs, but they're still cost burdened when it comes to housing. And then what a lot of these groups deal with is what we call permanent supportive housing. And we really don't have enough of those kinds of units in Oklahoma City either, where we can provide the kinds of services that those individuals need to make sure that they don't end up being homeless again. So there's just a lot of complexity to it, but it really does all come down to, and you've heard it over and over again from everybody here, having enough units available for people to live in.
Thank you. Ranya, the Curbside Chronicle not only provides a voice to low-income populations, it also provides an employment opportunity. Tell us more about why you chose this model for Curbside and the broader role that employment opportunities play in the goal to move people toward a more stable life.
Yeah, so Curbside was absolutely inspired by the network of street papers and the impact specifically of the contributor, which is the street paper in Nashville, Tennessee, where our other co-founder, Whitley O'Connor, went to school, and just the way that street paper was helping shape the dialogue around homelessness in that community, because homelessness had a face, it had a name, it had a person behind it, and so the general community, they were able to talk about it less of as like this issue, right, and more of, I interact with Bob every morning, or I interact with Judy every afternoon, and I see the impact, and I see that these are numbers. Yes, they are, but there are people behind every single number that we're talking about, and that's what I think is so important. And we were really inspired by the conversation and how people were kind of collaborating around that street paper, so we wanted to try and emphasize that in Oklahoma City. I'm a big believer in humanity. I believe that we do truly care about these long-standing issues like homelessness. We just need tangible ways, like we're talking about, to be a part of the solution, right? Whether that's big ways, like helping us create more affordable housing, or whether that's seemingly small ways, like buying a magazine for $2 from a person. But those small actions really add up. And so what Curbside does and the role employment plays is I've never met a person, and I get this question a lot, that doesn't want an opportunity to support themselves or to provide for themselves or to make money in work. That's not something that's common. It's just that where a lot of the people that we work with, given their circumstance, especially since we mainly work with people who are street homeless, people who are chronically homeless, so meaning that they've been homeless for extended periods of times or repeatedly, like kind of when you think of a chronic illness, a similar definition for that with chronic homelessness, they have a lot of barriers, right? And so even with Curbside, while we are employment, we have a philosophy that a lot of service providers in Oklahoma City are embracing, which is called Housing First. There is an article about it in the magazine that we've given you guys, so I won't go into too much detail, but the concept behind that is that whenever you're experiencing homelessness, like even Dan mentioned, logically the first thing that we need to work with you on is housing, right? It's like Maslow's hierarchy of needs. If you don't have safety, if you don't have security, if you don't have shelter and food and water, you can't work on, goal actualization and self-esteem building and all of those other really important things that we need to have rich, purposeful lives. And so even with Curbside, we give people a way by selling our magazine that's low barrier. You can come to a training every Tuesday and Thursday Tuesday morning and get started. You don't have to have $1 in your pocket. You don't even have to have an ID, which again is another barrier. People on our streets and in our shelter systems, their social security cards can get rained on, they can be lost, they can get taken, and those are important documents that you need in order to, apply for mainstream employment. But it can take months for us just to get those documents reinstated. In the meantime, Curbside and our philosophy just believes that everyone deserves an opportunity to have a chance to provide for themselves, and that equal transaction. So like we talk about, whenever you purchase a magazine for $2, yes, your money is going to support a person that is working and trying to better their situation, but we can't forget or negate the fact that they're giving you a quality product in return, a quality product that many of them have helped create by sharing their story, and that equality of transaction helps build self-esteem and confidence. And I know that that's the more touchy-feely emotional side, but in addition to the monetary side, that goes so far in a person's reintegration back into society and community. And so all of our case managers work with our vendors on housing, and then we use that as a launching pad to talk about what's next and what the transition from selling magazines to working, a 9-to-5 community-based job can look like.
Very good. Okay, a question for all of our panelists. What are some of the best practices in reducing long-term homelessness? And if you could wave a magic wand and implement a new or an improved approach here, what would be the first program you would choose? Dan?
So we look for national best practices all the time. Ron, you mentioned one, Housing First. The Homeless Alliance, in partnership with some other agencies, brought that model to Oklahoma City in 2013. As a community, we now have coordinated entry, also a national best practice that allows kind of a no wrong door approach. So no matter what your barriers are or where you show up, you're getting the same assessment, and we can work together. Information technology infrastructure in our business, like in everybody in here's business, is super important, right? So in the 21st century, every company is a software company, including homeless shelters. So having that information technology infrastructure that allows diverse agencies to share data on shared clients is critical. But as everybody here has said, the one thing that would make our numbers better is more affordable, accessible housing.
Thank you, Dan. Cathy?
Well, and that's what I was going to talk about is really the need to develop more affordable housing and the ability to develop local programs that can complement some of the federal programs that are still in place. There's the low-income housing tax credit program that helps to develop units that are affordable, but having other resources here locally that can help us either, for example, maybe acquire some B and C class apartment complexes that aren't in very good shape and redo those into new units. To develop some local programs that help us improve home ownership, because ultimately at the end of this, we want people to own homes and live in their own home. So, maybe more programs that support down payment assistance programs and other ways for people to get into their own house. Oklahoma City's begun to do some of that, but we have a pretty limited amount of resources available for that. So, I would like to see some expanded resources to do some of those kinds of things.
Rachel?
Anytime an agency poses that they have the solution, they're going to fix a thing or a solution to, we're going to solve homelessness, it causes me pause. Because this really is, this is a community social ill, and not a single one of these agencies, even though they're all excellent, will be able to solve that. And I think the trap is to look at innovation and let that overshadow compassion, because we get to stay further away a little bit. We get to say, if only we had a new widget, if only we could employ these best practices that this other agency does in this other town, if only we had another task force. And so if I could wave a magic wand, I would ask that you all remember that homelessness is born out of a lack of margin when a catastrophic event happens. If you can just switch your mind and know that, and resist the urge to other is a thing that we do for safety, for personal safety. And compassion happens when you lean in and you stay curious and you get to know people like Ranya was talking about. When you know someone, then and only then can you effectively help them. Like, that's it. And then the other thing I was gonna say is, in that, the first step, and I know it can feel so awkward, and I can tell you that everyone on this stage, we have awkward conversations every day. And so when you're stepping into that, like, I don't know anyone who is living unsheltered, I don't know how to get to know someone, something that has a profound impact on us all is eye contact. And I know that sounds so oversimplified, but that is the truth. When you can see someone and you stay curious and you get to know someone, then compassion evolves. You can't help it. That's what comes up. And then let that compassion lead every decision that you make. So if you're making it from a politically empowered place of a business person, and you're able to sit at this table, right? Like, I find it interesting that we are the ones sitting here speaking on behalf of people that didn't get the invitation today. So when you know someone, you're able to do that more effectively, advocate for them more effectively when you can. And then on a personal level, just get to know someone and implicate yourself in their story. And that is how something as systemic and widespread as homelessness is solved.
Very powerful. Ranya, your magic wand?
Yeah, I mean, I think Rachel's point to innovation is really key. At least that was really inspiring to us with Curbside, and it's not traditional employment. We understand that. We understand that it is a little bit out of the box thinking, but in communities all across the United States, there are social enterprises and there are businesses like Street Papers and then beyond that are making a really lasting impact. And that's something that inspires me and encourages me. I'm not afraid to be a copycat. If I see something in another community that's making an impact, I want it in my community. And so that's how we got Curbside, and that's how Curbside is starting to kind of develop into a second tier of social enterprise and supportive employment. For many of our vendors, it's possible for them to transition readily into mainstream employment from the magazine. We help people get into housing, and then they can move into a maintenance position, a warehouse position, a retail position, et cetera. But for some of our folks, that still is a big jump for them. Just because Curbside is a different atmosphere. You set your own hours, you're still outside, it's a little bit more loose, and so they need a little more constructed environment. And so we're working right now to open up a floral shop, which is really exciting. That's, again, just an expansion of our Mother's Day and Valentine's Day flower campaigns that we've done. And that's one idea, but it'll be, people will get regular shifts that they're going to be interacting with customers in that more retail setting on a regular basis. And so that's just, again, another training ground for us to help folks practice and build these everyday job and life skills that they'll need to succeed. But that's one example, and there are other things happening in communities all over, screen printing shops, bakery shops, things like that. Even in our own community, I mean, Dale Rogers has done an incredible job providing employment opportunities for people with disabilities, Goodwill, et cetera. But I would just love to see even further more development of businesses giving second chances to folks and providing that training ground where people who are stabilizing on their mental health medications, get a little bit more understanding when they come to work and how that can work. Yeah.
Very good. One more question to our panel before we open it up to the audience. How can the business community rally around this issue? What role do our audience members play in this ongoing conversation? So, Ranya, we'll start with you this time.
Yeah, I mean, so with Curbside, it's simple. My biggest plea is going to be whenever you see one of our vendors, I hope that, I think many people in this room might be familiar with our program, but not everyone in it is. And so I understand that there can be some hesitation of, people are wearing a uniform, they're selling this magazine, something's going on here, but is this legitimate? And so I hope that this maybe helps legitimize and provide some context to what our vendors are trying to accomplish and working towards. So the number one thing is, please feel free to engage. Buy a magazine for $2. If you don't have $2 on you, like Rachel said, share a word with someone, ask someone how their day is going. But then, beyond that, I think that there are ways in our personal lives. I think we all work for different companies. Some of those, might be real estate companies and might have the ability to offer or even just look into what providing affordable housing could look like. Maybe somebody is a hirer and, in the past has had pretty strict hiring procedures, but maybe you would be open to being a second chance employer and working with folks who maybe do have criminal convictions in the past. I think that there are all ways that we in our personal spheres can make a difference. We just have to kind of examine what those are. And fortunately, we have a bunch of nonprofits out there, not just the ones that are sitting on this stage, that would love for you to reach out and ask them, hey, this is my situation, this is where I am, I want to help, how do you think I can be a part of the solution? Because I can tell you, nonprofits, we have a laundry list of ways that you could plug in.
Yeah.
Absolutely.
Thank you. Rachel?
Yeah. I just, again, want us to remember that City Care, we deal a lot with those individuals that are at that 30% AMI. And so it's very complex. These barriers are very high. And they're very layered. You've got mental illness on top of substance abuse, on top of chronic homelessness, on top of physical disability. And so as the people sitting in this room, as business leaders, what we can do is we can clear the way. So they're in the wilderness without any tools. And we are sitting here in this room, and we have the tools. We know the people, we know the answers, and we know how to get laws passed. We know how to convene and rally people. We know how to build houses. We have all of those answers. We don't need to research anymore. We just need to all pull on the same rope. And so as business leaders, what you can do is you can go before those individuals that are in the wilderness without the tools, and you can mow down a path so that they can then get into stable housing. So when Ranya tells you, here's a dignified income opportunity, clear the way for her. When I tell you we need to build another shelter, clear the way for City Care to do that. So that's what I would just ask, that you use your influence to benefit those that have no power in this community and have nothing to offer you back in this moment in time. And just watch the flourishing that happens when we all come together around this.
Cathy?
Yeah, I really just want to maybe re-emphasize what you've already heard. I think the business community can really do a lot to clear the barriers, open up employment opportunities to people who face barriers to employment, and accept these people that are facing these challenges as a part of our community. One of the things that we struggle with even affordable housing, even in projects that are what we call mixed income, that may have some market rate, is people get into this real not in my backyard kind of syndrome. And I think we all need to recognize that these people are us. They're our kids and our aunts and uncles and cousins, and they deserve to be in places that have good schools, that have access to transportation, that have employment opportunities. And I just really think it's important for us all to think as a community about barriers and accessibility and immersing these people in this community that really is a very, very caring place.
Yes, so I would certainly echo everything that's been said. Just in this room and in our business community generally, there's a great deal of time, talent, and treasure that could be put towards resolving this issue once and for all. I honestly believe that Oklahoma City could end homelessness. It ain't rocket science. It's housing and compassion, and it's folks like you that can make those things happen. if there's a silver lining to a community like ours being maybe a little more disaster prone than you would like, it has taught us the value of close collaboration in the nonprofit community, in the faith-based community, and in the business community. I mean, after the bombing, this whole city came together. After the May 3rd tornadoes, this whole region came together. Homelessness is those things in slow motion. If we could fix those, we can fix homelessness. But it's going to require leadership from people like you.
Thank you. So we do have time for questions from the audience. So if you have a question, I think we have a chamber staff members with microphones. Right over here. We got a couple.
Hi. I've heard rumblings of the idea that a tiny home community might be in the works. Do any of you know anything about that? And is that something that is going to happen?
There is a tiny home community in the works. And these two people right here can probably tell you about it.
Table 205.
That's a plant.
Melanie Anthony with Pivot, a turning point for youth. We work primarily with young people that are suffering from homelessness, so 15, 16, 17, 18 that have not been picked up in foster care, living on their own. The challenge for those that are under 18, they cannot even sign a lease in Oklahoma City proper or other municipalities. So there's a barrier in that itself. The tiny home community on our campus, we're doing a little bit different. We're not doing scattered housing with it because they will primarily be probably 16 to 20 that are living in these tiny homes, so that we're putting them on our campus. So they have immediate access to our therapeutic care team, our mentors, our educators, employment specialists, and things like that. So if they are 17 or 18 because of the trauma they've gone through, if they're in crisis, we have that ability to get right to them when needed. But we are working on that right now, and our first 3 should be open and available to youth on the first week of August. And we have already identified the first 3, and they're very excited. We're excited too, sorry, my voice is shaking.
Following up on that question, what trends are we seeing with unaccompanied homeless youth in our community, and what facilities, what's available to them to address their specific needs, and then what ideas have we generated in terms of legislation to help emancipate these individuals when they run into legal barriers like were just referenced?
So we've had some challenges with homeless transition age youth this year. We really had 3 solid providers, and one of them went out of business this fall, or this late spring, so we lost that provider, and that was 20 shelter beds and a lot of supportive services. We fortunately still blessed to have Pivot in the community and CSU Youth, both of which provide shelter, neither of which is adequately funded. So tell Jennifer I said that. About 40% of homeless youth in Oklahoma City self-identify as LGBTQ. And so working with that population requires a fair degree of cultural competence in that area. So that's one of the big challenges. In terms of legislative efforts because we work with 16 and 17-year-olds all the time, and Pivot does too, that really need to be emancipated, but that process takes so long that you're better off just not wasting the effort and wait until they turn 18, because you won't get it done through the system before they age out. And so I'm not really aware of any legislative efforts to change that, but it's a barrier to getting transition age youth into housing. Were you going to say something, Mallory? There is one.
had the opportunity to check in, to opt in to care. So that's one thing that's been discussed. It is on the table for next year to move forward, but it's one of those fine lines where, again, there's going to be funding needed to identify, but a 16, 17-year-old that hasn't been placed on a DHS caseload already is already because of either A, they haven't identified, B, caseworkers are already overloaded and they're focusing on the littles and working their way up, especially if they're already plugged into a program like one of ours. But we are discussing, and there is discussions about that, as well as employment opportunities for those young people that are in foster care transition age and having employment opportunities as well. And I can't remember the bill names, I'm sorry.
Speaking of employment, I might comment on that really quickly. So exciting news as well at the Homeless Alliance is we have a new program called Sasquatch Shaved Ice that recently joined us. And so it's a snow cone stand. Currently it's in the Plaza District, but we currently have funding and we're working on building out a second stand location. And then we also have a mobile unit that's gonna hit streets next month in August. And this employment program, recognizing the needs that youth are a little bit different than our older adult middle-aged employees, we have that crafted for the 18 to 24-year-old age group. And so it's, again, supportive employment in a little bit more of a traditional environment, a snow cone stand. And so that is one of, I know, numerous, I think, options that in services that are coming into town. I know Ben Knuckles and the Commonplace crew are working on a restaurant concept that will also work with transition-aged youth. And so it's exciting that people are recognizing that we need to invest in our youth and help them build the skills early on so that hopefully we can prevent them from needing our services in the future.
Yes, you mentioned mental health a couple of times, and I know that's a huge barrier, trying to get people rehabilitated and back into employment, but the cost of medical care, the cost of prescriptions, what are we doing for that, and what can we do more of?
So mental illness is definitely a contributing factor. The thing that's really important to remember is there are 100 times more people with diagnosed mental illness who are housed than are homelessness. So mental illness does not cause homelessness. If you are mentally ill and experiencing homelessness, you have an additional barrier, but it's not a cause. Now, the availability of treatment and medications is really extremely limited, and very few inpatient resources that we can refer to. The crisis centers both do a fantastic job, but they don't have enough beds, and so the sort of barrier for getting into a crisis center can I mean, you have to be a clear and present danger to yourself or others, and boy, that gets defined as I got a knife to my throat or his throat. Just being a potential victim of like exposure because you're out on a porch and it's 12 degrees outside. That's not enough. So the resources in the community are really limited. We're blessed that we have 3 really good community mental health centers in Oklahoma City: North Care, Hope Community Services, and Red Rock Behavioral Health. But again, like I mentioned with Pivot and CSU, they do not have the resources. County Pharmacy provides a lot of low and no cost non-narcotic meds, including mental health meds, but it's got to be what's in their apothecary, what do they call that, Joe Beth? Their pharmacology, whatever, their stock. and so they don't have like the modern ones, the subcutaneous ones that are time released, and so accessing those medications can be a real challenge, not just for people experiencing homelessness, but for any uninsured person.
Yeah, I would only add to that and Ranya touched on that housing first philosophy, and I urge you all to read about that in Curbside, because that really is the foundation upon which every other success in life can be built. And so for someone who is struggling with unmanaged mental illness, not having a place to lay their head at night sure makes that hard, to make those appointments and to see their case managers and their health providers. So housing first is something I would love to see Oklahoma City just really rally around. And Homeless Alliance, brought that concept to Oklahoma City many years ago. But I still think mainstream, it's a little under the radar. So I'd love for you to learn more about that.
So homeless veteran is something that should never be uttered from our mouths. I mean, these are people that serve the country, and everybody here is quick to thank a soldier, for the service, but it seems like we do nothing after. So my question is, how much funding are we getting from the federal government for homeless veterans, and are we doing anything about it, specifically about them?
It's an excellent question. I wholeheartedly agree with you that homeless veterans should not exist. In Oklahoma City, we have a broad-based community collaborative called Journey Home that works exclusively with veterans and with chronically homeless individuals. It has its own funding stream. Oklahoma City's homeless veterans make up about 10% of our total homeless population. In most big cities, that's closer to 20%. So we've made some real progress. Because we have that information technology infrastructure and the by name lists and all that kind of stuff, we know who our homeless veterans are, and we're marching through that list and moving folks into housing. When we started out with about 300 or so, and in the spring of 2016, we got down to 50. We were this close. And then we ran out of housing vouchers, and now that number's back up around 120. We're not losing ground, but we're not really making ground on that. So, and it purely is a resource issue. It comes down to the housing.
Other panel member?
Kind of monopolizing. I'll stop that.
We spoke a little bit about what the business community can do and also what individuals can do, but I can't help but notice there's a lot of elected officials in this room right now. What can elected officials do to combat this problem?
Well, I guess I know that there are a lot of public meetings going on right now, and I'm sure that the council representatives are fully aware as well because they've been at all of them. But that's something that I think, that's not just for council's consideration, that's for everyone in this room. I mean, MAPS 4 is coming up, and that's a really big initiative and a really big vote. And I mean, in regards to the mental health question earlier and the affordable housing that we've been talking about, and Palomar has a criminal justice center that's on the table too. It's been really inspiring in my perspective to have those be at the table and be part of this conversation of what MAPS 4 funding could go towards. And so I'm excited and encouraged to see how these community conversations continue and to see which ones move forward. And I would hope that if this is something that you're passionate, homelessness, there is a public hearing on July 31st at 9 a.m. In the council chambers, and we would love to have supporters be there in attendance and to speak, or if you can't make it, to reach out to your representative and tell them about if homelessness, mental health, and all of the things that you think could be and should be addressed, not just with private dollars, but with city dollars as well.
And I would add, the elected officials that I see in the room, my personal experience is that it is top of mind and it is their passion. I have sat through council meetings and just watched, I tweeted about it. I tweeted about the master class that I saw put on by these elected officials who continually brought up those that are pushed to the margins. Like it is on their mind and it was their priority. So anything that came up, I watched them think and then say, how will this affect someone who's on the margins or someone who isn't naturally at the table? So I think we're in a really lucky position, truly, with the leadership that we have in this room.
Well, if we could, let's give our panel appreciation. Thank you much for sharing your expertise and definitely the passion that you have on this issue. I'd like again to thank our signature sponsor, Cox Business, and our corporate sponsor, ADG, for their participation in today's event. We hope you'll join us next month for our August forum. From festivals to live music, sporting events, and more, Oklahoma City has become quite the location for destination events. We'll hear more about the impact those events have on our economy. And please note that the August forum will be held on Thursday, the 22nd, so make sure it is on your calendars. You can learn more about that event at www.okcchamber.com/August forum. Thank you so much for being here and being part of the chamber. And again, thank you so much to our panel. We are adjourned. Have a beautiful day.
I'll be right back.